representative of the World Health Organization, Dr. Chukwuemeka Ogu, the former Commissioner for Health, with whom we started this program, Dr. Joe Akabike, Ndi here present, His Royal Highness Igwe Victor Ntoka, IL the First of Nsugbe, and His Royal Majesty Igwe Ekoba of Umoba, Igwe Ekwala of Umoba now, Lolo, the OCI Foundation's legal advisor, Barrister Onyechi Ononye, and all the other key officers, trustees, and volunteers of the OCI Foundation. The OCI Foundation sole ambassador, Mrs. Ebele Okaro in UK of the Nollywood fame, and all the other Nollywood ambassadors here present, the PPSSC zonal directors and board members, gentlemen of the press, ladies and gentlemen, I say welcome. Thank you very much for being here today. We feel very privileged to have you all as guests and witnesses to this historic event, which is the official commencement of the ArOY Youth Campaign. We'll be proud to remember. I'll share a couple of stories with us all that will underline why we are doing this program and which we can all relate to. Nearly 15 years ago, I was a youth copper in Oyo State. A copper colleague of mine walked up to me one day and was in tears. And I asked him, what's the problem? He told me that his big sister, who at the time was 28 years old, had just been diagnosed with breast cancer. He wanted me to tell him that the lady would survive, because I couldn't tell him that. I told him to get more information and find out what exactly is the problem. About a week later, he came back even in bigger tears, and the problem was the cancer has gone beyond the breast. The family was broken, the young man was broken. A family that was once happy became a bit hopeless. I don't know where the young man is today. I've not been able to track him down. I don't know what became of the fate of that young lady. The second story was when I was a house officer at the Lagos University Teaching Hospital in Lagos. The lady in question was my patient, our patient. She was in her mid-40s, and the problem was cervical cancer. As a young house officer, we do rotations. I left the unit before anything could happen, only for me to see the daughter a few months later, and she told me that the mom passed away. She became motherless, and obviously their dad became a widower. I'll come back to these stories later, but briefly, the ArOY Youth Campaign is the flagship health initiative of the OCI Foundation, designed to be a wide-reaching, sustainable, and cost-effective way of spreading breast and anti-cervical cancer messages to millions of at-risk Nigerian women in a way that is timely, efficient, and culturally acceptable. Primarily, this campaign targets students across all senior secondary schools in Nigeria by introducing the relevant teachings into their regular academic curriculum, along with assessment and examination systems. Through the CERVIBREAST mobile phone application, which is now available on the Android Play Store, this campaign will potentially be within the reach of every single Nigerian. The ArOY Youth Campaign is novel, it's an invention. It is comprehensive in its packaging, it is engaging in its delivery, and it is unique in its offering. It is unique because, to the best of our knowledge, it's the very first campaign anywhere in the world to target young women in their mid to late teens while in our formal academic settings. It is unique because it's the first to have the teachings that will be repeated multiple times over a number of years for the same cohort of students. Along with its inbuilt assessments and examination system, This feature improves engagement from the participants and will guarantee long-term sustainability of the lessons they gain. These are the major weaknesses of previous existing campaigns. Ladies and gentlemen, this program is also unique because the scientific evidence that underlies the initiative was scrutinized by multiple experts around the world and published across 5 different peer-reviewed journals of international reach and reputation. There are many other reasons why this program is unique. I'm going to put us through a few of them. It is the current program that is being rolled out across today. We are fine-tuned through the input of a 28-man working committee. This committee, many of whom are present here today, were made up of representatives of major stakeholders and religious faiths in Anambra State and Nigeria. They ensure that the program we are offering is culturally, religiously, professionally, and technically acceptable to all concerned. This program is also unique because it has an evaluation and a research component attached to it. And this evaluation is being overseen by the Griffith University Medical School in Australia. The research team for this program has in its fold 5 seasoned academics drawn from 4 different universities across 2 countries and across 2 continents. Some of them are here, and this team boasts of at least 1 university professor, at least 1 associate professor, at least 1 senior lecturer, and at least a lecturer. This program is also unique because it's a nationwide program. By 2025, we believe that all schools will be benefiting from this across all communities and all the local government areas in all the states and geopolitical regions of the Nigerian nation. Anambra State is only the first to benefit and has this privilege simply because the foundation's activities commenced right here 2 to 3 years ago and have therefore garnered lots of support, goodwill, and the necessary buy-in needed for it to succeed. Finally, this program is unique because it combines a rare mix of teachings that promote high moral values with educative and life-saving tips. So, task of the day. Our task is also not just to celebrate the successful commencement of this program in Anambra State. Our main task, ladies and gentlemen, is to inform the rest of Nigerians that the OCI Foundation has them firmly in their sights and that the program will surely reach every single one of them. This promise should come as no surprise to those who have been with the OCI Foundation since it was established in 2016. It has been in our nature to carry everyone along. And with a life-changing innovation and initiative like this, we have pledged to do all in our powers to ensure that every single Nigerian benefits. Let us all remember that we did not just keep this gospel to the students in Otocha Educational Zone of Anambra State, where we started. We have no intention either of limiting this gospel to students in Anambra State. Who knows, we may even go beyond Nigeria with this message and mission. After all, this campaign is the first of its kind anywhere in the world, and the impact is expected to benefit all other developing countries in Africa and around the globe. This course is free. Even though we may not have the financial or political wherewithal to complete the tasks by ourselves, we at the OCI Foundation surely do not lack the courage, nor the dedication, nor the commitment, nor the skills to complete this task. Ladies and gentlemen, at the OCI Foundation, we do not just dream. We work hard to make our dreams happen. Put in another way, we live our dreams, and we know exactly where our dreams will take us to. As such, we know where we and Nigerians are headed with the ArOY Youth Campaign. So please permit me to invite us all to a 20-year journey into the future of this campaign. Let us all imagine this. In about 20 years from now, we'll have an Anambra State where the ArOY Youth Campaign would have been in operation for about 2 decades. and in Nigeria, where the campaign would have existed for at least 15 years. In 20 years' time, the senior school students of today, who are mostly in their mid-teens, will be in their mid to late 30s. Majority of them will be parents. Some of them would have their own families, and some will be involved in either the policy making or policy implementation across the Nigerian nation. In 20 years' time, there will be tens of millions of under 40-year-old Nigerians who will be well versed on the preventive strategies, the early symptoms, and the risk factors of breast and cervical cancers. These Nigerians and those associated with them in any way will be well armed to know when to seek for help without waiting till it's too late. These young people will be able to tell a grandma that that lump in your breast could be dangerous. They will be able to tell someone, a sister or a friend, that that discharge you have could be a symptom of cervical cancer. Hopefully in 20 years from now, cervical cancer vaccinations, along with the relevant screenings for both cervical cancer and breast cancer, will be freely available in Nigeria. We hope that will be the case. However, the beauty of the ArOY Youth Campaign is that, should this never be the case, the campaign's beneficiaries will already be well prepared and ready to not only embrace the changes when they come, but they will be able to actively seek for these interventions. Simply put, this campaign will complement any future intervention. It even gets more interesting if we move from 20 years to 50 years into the future. Some of us here today may not be around then, but surely some of the students we are arming today will be there in the future, either as governors, or as ministers, or as lawmakers, or as company CEOs. Can we please pause for a second and imagine the kind of healthcare programs these future leaders will put in place when they eventually take over the reins of leadership in this country? So you see, we're not only creating enlightened youth, we're also grooming future healthcare leaders. The foregoing discourse is the future that the OCI Foundation dreams about. It represents the dream that has been encapsulated and presented in the ArOY Youth Campaign. This is why we want to arm our students young. This is why we want to arm them now. And this is why we want to arm them all. This is why we have spent so much and worked so hard to make this day possible. And this is why we will never relent. To us, the campaign is among the most important healthcare innovations and strategies in Nigeria and the developing world in recent memory. This program, our OCI Foundation is willing to work with anyone and with any group and with all interested governmental or non-governmental bodies to actualize a nationwide implementation of this project. Open your doors to us. Open your ears to us. Let us all do this together. This project is for everyone. This project is a win for everyone. Women, men, fathers, mothers, employers, and the society at large. Because everyone has something to do with a woman, either as a child, or a sibling, or a parent, or an employee, or a friend, or a work colleague. According to the WHO, the representatives here, roughly 14,000 Nigerian women were diagnosed with cervical cancer. Well, then about 14,000 women, Nigerians, every year get diagnosed with cervical cancer. And unfortunately, over 8,000 of these women will die. Children and a whole lot of others devastated. We remember the story I told you when I was a house officer in Lutif many years ago. We can either continue to accept this unfortunate trend, or perhaps just pray over it that we always do in Nigeria. Or worse still, we can just ignore it and hope it goes away. Alternatively, we can stand and fight. At the OCI Foundation, we have chosen to do just that. Stand and fight with our women. And comes at huge financial costs, with no guaranteed sustainability of the lessons passed on. The ArOY Youth Campaign correct all this. It has the potential to reach millions at a time. And apart from the initial setup costs, it comes with minimal financial implications. It is also well aligned with the United Nations. Ladies and gentlemen, in rounding up this speech, may I remind our guests that the OCI Foundation was established with the primary aim of bridging and breaking down barriers to the attainment of health and educational excellence among Nigerians. It was formally registered in both Nigeria and Australia to promote and advance health, to advance education, and to advance social and public welfare. Our scholarships and educational activities have benefited dozens of brilliant but less privileged students and pupils across junior secondary schools, senior secondary schools, tertiary institutions. Some of them are here today, and we're proud to say this, and hopefully we're going to hear from one of them. The lady that sang the poem is also a beneficiary of the program. That's Nnamdi. Thank you everyone once again for attending this event. Thank you to all the staff and volunteers, and all our champions and sponsors, and all our partners, most of whom are here today. Thank you to our Nollywood friends. Thank you to the media, and all who have worked behind the scenes to make this day a success. I invite us all to be champions of this campaign in our own little ways. Let us all inform our family and friends. Invite them to download the OCI CERVIBREAST app. And not just to download them, but to share them with all their friends and contacts at their workplaces, at their schools, the churches, the mosques, and most importantly, social media. By doing this, you would have all partnered with the OCI Foundation as we rise by lifting others. God bless you all.
Wonderful. This is awesome. This is awesome. If you